Before we start talking about just the surgery part, realize that most people ever consider intervention, they have to fail all the conservative therapy, meaning their symptoms, leg pain, back pain, or any leg symptoms, arm symptoms have not improved with conservative therapy, including medication, anti-inflammatory, neuroleptics, or with injections, or time and physical therapy, or chiropractic manipulation, that they have not improved. And then we know that they have an MRI that shows some type of pathology that's causing their symptoms. So endoscopic spine surgery is really, how do you treat that abnormality, that compression on the nerves that's causing the pain, as to how you get there. So if we look at a very simple spine, right? And this is continues in the neck and thoracic spine. But this is the lumbar spine and the sacrum, and here's the hips on the sides, and the patient is facing that way. This is the front of the spine, where this white bony vertebral bodies, the disc, the yellows are the disc in between, and these are the nerves that are coming out on the side. But then if you look at a point of the view on the front top, this is the spinal cord coming from the head all the way down to the lumbar spine and sacrum. So there's the spinal cord right here in the middle of the structure. So what happens with time, there's ligaments here, and there's bony deterioration, and they hypertrophy. That means they start compressing on the nerves and the thecal sac, and that's what causes the different symptoms, such as spinal stenosis, which you can't walk as much. It causes lumbar radiculopathy, that you start having pain down your leg or your neck. So those type of things all lead to different pathology. As to how you get there is the thing. Now, the way we do it, here's the back. So when we do open surgery, we make an incision in the back and open this up and do whatever we need to do for the decompression, lumbar fusion, or any other pathology. But with an endoscope, we can actually bring a scope that's less than the size of a penny and bring it from the side or from the back and actually treat the pathology right at that level. So if somebody has, here's, like we mentioned, here's a nerve, here's a disc herniation, we could actually bring a scope right here and take care of the herniated disc and not have to touch anything. It takes 25 minutes to a half hour, and patients can go home in a couple hours afterwards and resume their normal activity. So, and in the open surgery, we'd have to come from the back and try to open this up and free that up and take care of that. So depends on what the pathology is, what's causing the symptoms, as to which approach you go. But the endoscopic spine surgery removal, we can actually directly visualize the pathology and remove it and take care of it for the patient. So it increases our armamentarium of different techniques that we can use to treat the patient. So think of this as a patient's spine. This is the front, the back, this is their hip, and this part is patient's lumbar. So the head is in the front, and the head is up here, the face is here, and this is the front of the spine. So what we actually do is, with endoscope, this is a scope. Look at the size. It's less than the size of a penny, American penny. And you can do is look at that and be able to percutaneously place that through incision and place right where that disc is and see it and remove it. And you can watch it on a big screen and be able to record and watch what you're doing and what you need to drill. So any compression that we were talking about earlier, the patient has a disc herniation or bone compression of the nerve, we can actually remove that and see it live. And it's really helpful because, just for experience, we had a patient that had a herniated disc this week that he'd been miserable. He had a recurrent disc herniation from a previous surgery by somebody else, and we were able to bring the scope in, and by the time we finished the surgery in about a half hour, he was going home in an hour and all his pain was gone. All that herniated pressure that was causing the weakness was all gone. So the recovery is very quick and very easy, and you can achieve the same skills with open surgery, but just with endoscopically, it just makes it easier, less destructive, and more effective. And even though most studies shows the effectiveness is about the same, but just patients seem to be doing better. I would say overall, number one is patients really do benefit from the right surgery at the right level to the right patient and when they fail conservative therapy. Endoscopic on top of that can offer Just like with robotic surgery, with endoscopic surgery, it offers is more effective, efficient, and less pain, more faster recovery, less blood loss. So those all things come in handy, but you still have to be doing the correct surgery for the correct reason and why patient needs it to benefit. Like we mentioned, or you may not know, but as 35 years ago when I started doing the neurosurgery training, there was called the endovascular treatment of cerebral aneurysms, where you can do minimally invasive techniques to treat cerebral aneurysms and malformations of the head and tumor. So now we kind of applied the same techniques and same skills to the spine surgery. So we've been really able to achieve the success in getting this done. And I think this just increases our armamentarium of all the things we can treat for spine surgery, both minimally invasive, open, robotic surgery. It really offers a full armamentarium on a patients that really need surgical intervention.